My name is Ruel Okeo, and welcome to today's webinar session. So, just trying to get a hang of, where it is. So please feel free to make sure that you let us know where it is you're watching us from in the chat box. You can leave a brief description of, say, your name and where you're watching us from, and also as well, what time is it? Because we're watching this from different parts of the globe. So today we're going to be having a self-care day webinar, which we are commemorating the self-care month, resilience, adaptability, and thriving in adversity. So, if we have to touch is anyone talking? Kindly, if would request you to mute your mic if you are on the phone call, please. If you could mute your mics. Thank you. So today we're going to be talking about self-care and, just a brief background, when we have talked about the WHO guidelines on self-care for health and well-being, define self-care as the ability for individuals, family, and communities to provide, maintain, prevent diseases, and cope with illnesses with or without the help of a healthcare provider. So self-care is the power of individuals to prevent and treat diseases themselves, in the context of a safe and supporting, enabling environment. It does not replace the healthcare system, but instead it does provide, additional choices and options for, self-care. So today being a very, very amazing and important day, I feel really excited to be here today and to host this. We're going to have such a wonderful session. So feel free to contribute to the conversation by using our hashtag YouthWISE for self-care and tag our partners AIDS Fund International, at UNICEF _AIDS, and at Y Plus Global. We have English and Portuguese translations in your webinar control, so please click the interpretations, click the languages that you would like to listen to. So if you have no idea where that is, there's always an icon that resembles the globe. So that is what can be used to, get the interpretations language. So we do have English, Portuguese, and French translations. So please be sure to check that out as well. So, it's nice to meet you. So use the chat box to let us know your name, organization, and where you are joining us from. We understand this is a global platform, so everyone's watching us at different places, different time zones. So it's really interesting to get to understand where it is you are watching us from. And we're going to have this session run for 1 hour and 30 minutes. And, so you can use the chat box as well for the Q&A function to ask your questions, give comments, questions will be collected and answered at the end of the session. And feel free to specify the panelists you're addressing the questions to. We're going to be introducing our panelists in the next few minutes. So if you have a question that is in line to one of the panelists, feel free to, direct your question towards them. Or if you're shy, just leave it and we're going to tackle it at the end of the session. So, self-care, we have talked about self-care again. And, as we have established self-care, it's just an aspect of taking care of ourselves. We need to understand how to maneuver that. And, the guidelines that are specified by the WHO, as they classify the ability of the individuals, families and communities to promote, maintain health, prevent diseases and cope with illnesses with or without the help of a healthcare worker. And self-care, as we have established, is the power of individuals to prevent and treat diseases themselves in the context of a safe and supportive enabling environment. It does not replace the healthcare system, but instead it provides additional choices and options for healthcare. So thank you so much for being with us today. And so we're going to have a small video presentation for you guys to enjoy as we get to kickstart today's session. Although before that, I have something nice for you guys. So today we're going to be introducing 3 new things. We have classification, 3 sorry, yeah, we do have the 3 gifts, and that is adoption, of the guidelines in some countries, we have NPTs and DSDs that promote self-care and awareness and demand created among adolescents and young people. So those are the things that we're probably going to be tackling about today in today's session. So stick around and find out about that. So at this juncture, we are going to be presenting the WHO video on self-care interventions. So if I can turn it back to the host to cue us in on the video on self-care. Thank you so much. Nyasha?
Yes, really, I'm here.
Yeah. I have left you out, my dear friend. Maybe you could introduce yourself.
I know you.
Yeah.
No, that's okay. I was like, okay, I'll come again the next round. So hi, everyone. My name is Nyasha Fanisa Sitole, and I have previously done a lot of work with Global Y+ in terms of self-care related to sexual and reproductive health and HIV and AIDS. So I'll be the co-moderator today alongside Rieli. Back to you, Rieli.
Fantastic. Thank you so much, Nyasha. And yeah, so at this juncture, I think this will be the best point to now have the WHO video on self-care interventions. So if we can cue that up for the session, I would really, really appreciate that. So back to you in studio. Back to you in studio.
Ensuring the right to health for all requires a fundamental transformation in our health systems. The World Health Organization recommends self-care interventions for every country and economic setting as a critical path to primary health care and as a way to reach universal health coverage.
Devices, digital health, drugs, and diagnostics continue to evolve so rapidly that people have new ways of accessing their health care.
I look at self-care as a revolutionary approach, especially that it brings the sense of taking services closer to the community.
There is now a shift in the way we are beginning to manage health.
Self-care does not replace the healthcare system. It is the ability of individuals, families, and communities to promote and maintain health, prevent disease, and cope with illness with or without the support of a healthcare provider. Self-care shifts the focus away from a responsive approach towards a more integrated approach, which strengthens links between primary healthcare and communities and considers the holistic needs of a person. Self-care supports key principles of human rights and gender equality. In 2019, the WHO published guidelines on self-care interventions for health, with a focus for this volume on sexual and reproductive health and rights.
Là, le self-care est arrivé. Pour nous, franchement, et les travailleurs dans le terrain, c'est une bouffée d'oxygène. C'est-à-dire qu'on va répondre aux besoins spécifiques de cette population.
The guidelines address different areas that empower individuals to prevent, test for, and treat disease themselves in a safe and supportive environment. This includes supportive laws and policies, health financing, regulated quality products and interventions, and education.
In as much as communicating with the community is concerned, we use the language they can understand, and then we try and have a face they can relate with, as opposed to the white jacket and scrubs.
When there are effective, integrated health systems and supportive legal frameworks, self-care can offer new possibilities.
muchos ginecólogos, psicólogas, parteras, enfermeras se juntaron a tener una relación médico-paciente más horizontal y salir un poco del modelo hegemónico y darle herramientas a la mujer para que ella pudiera tomar sus propias decisiones.
The self-care work is the first line of defense on all health-related issues.
When individuals are given the opportunity to become active agents in their health, not merely passive recipients of health services, their health outcomes improve. Self-care can pave the way towards universal health coverage and a world where everyone is able to realize their right to health.
Oh, that's beautiful. That is beautiful. And yeah, so the aspect of self-care has to stem from a global perspective. And it's something that, we can't, we can no longer neglect it because it's something we have to put into consideration into our everyday lives. And as I like to say, self-care is a necessity. So we should make it a priority. So that is a really, really beautiful message that we have there from WHO. And Nyasha, do you want to take us up to the next session? Yeah.
Thank you so much, really. And once again, welcome everyone. I'm going to steer us in the next stage of our webinar, where we're going to actually invite the panelists that's really mentioned earlier on. They are going to give us some presentations to just talk about self-care, because this is really an exciting time, because I think from the 24th of June to date, the 24th of July, it's actually the conclusion, or it's now considered a self-care month, where the world is looking and paying attention on what we can do to improve self-care, especially that is related to our sexual and reproductive health and HIV. So with us today, I have a room of panelists. I'm going to invite them. Actually, I'll mention the name in the one-line introduction that we have, and you can put on your camera and just say hi to the people, so that I now have all of you in place and know that you're all here. So I would like to invite Wole Amin, the adolescent HIV lead, global HIV hepatitis and sexually transmitted infections programs with WHO. Ole, put on your mic and let's see if you're here.
Yes, Nyasha, I am here, and thanks for the introduction. Great to be here as well.
Thank you, Wole. The next one is Adewole Adefalu, Technical Advisor, Center for Health Logistics, John Snow. Please, mic on, Adewole, and your video if it's possible. Thank you.
Hi, Asha. Hi, everyone. Thank you so much for having me. Really excited to be part of this conversation.
Thank you, Adewole. The next one is Neda Chikonde Musonda, a nurse epidemiologist / adolescent health focal point person. Neda.
Hello, Nyasha. Hello, everyone. Thanks for the opportunity to be here. It's great.
Thank you, Neda. We're happy to have you in this space. Josephine, the board chair of IRP.
Hi, I'm Justine. Happy to be here and excited for this conversation.
Asante sana, Josephine. Thank you. The next one, Lucan Kundula with Y+ Malawi.
Can you all hear us?
Yes, we can.
I don't know if you're visible that side. Can you be able to see us?
No, unfortunately, we can't see you, but we can clearly hear you.
All right. Here's Luca with his introduction.
Hi, my name is Luca Chikwa Y+ Malawi.
Thank you so much, Luca. So thank you so much for everyone who has joined us. This is the panel that we're going to have today. So to continue with the conversation, I'm going to invite Wole from WHO. If you could go ahead and share with us your 10-minute presentation.
Yes, Nyasha, thank you so much. Let me first confirm that you can see me, you can hear me, and you can see my slides.
Yes, I can see your screen, I can hear you. I hope it's happening with everybody, I believe so. Please go ahead.
All right, fantastic. So thank you so much again. I mean, first of all, let me say, to Global Y Plus, it's a pleasure to be able to be with you and to share a few insights on WHO's guidance on self-care. I think some of it has been mentioned at the beginning, but also we had that really great video as well, which sort of summarized it. So what I will be doing in the next 10 minutes is to give just a quick framing presentation before we then go on to other presentations and the panel discussion. In my presentation, I'll be looking at, what self-care interventions are, why are we even harping on this at all, and how can we move forward in this conversation on self-care and self-care interventions. But I'm going to start, of course, with WHO's global vision. People talk about these. We call it triple billions, and it's such an elaborate, huge goal to reach 1 billion people with universal health care, to reach 1 billion people with better health and well-being, and of course to have 1 billion people benefiting from universal health emergencies. So these are triple billions. As you can see, those are quite gargantuan, so big aspirations. Now, the only way we can get that is through doing things differently and being quite innovative in the way that we work. And that's that key message that I'm sharing on this slide, which actually comes from WHO as well, that self-care has the potential to help to meet, these really huge visions and lofty goals. In terms of defining it, I think the chair at the beginning had mentioned, the definitions, and without trying to go too much into it, self-care interventions and the tools, first of all, they have to be evidence-based, and they include all of those other characteristics, including the supplies, the drugs, the devices, the diagnostics that help to provide those interventions. But then in terms of its definition itself, you look at that circled part, it's the ability of individuals, families, and communities to promote their own health. And really, in all of these definitions, I've tried to highlight the most important definition in all of it, and that is the definition of self. When you're providing care for yourself, or even for yourself in the context of the epidemic that we have, it's important that we look at the different things that make us who we are. The diversity that we know exists amongst us, the values and the characters that we have, the purpose that we have, towards making sure that what we want in terms of better health and well-being gets manifested by using these self-care interventions. And then the question, of course, becomes why? Why do we, especially at WHO, we've, like you saw in the video, we have a new guide. Well, it's an old guideline now, from 2019, but it's something that keeps coming up. We have a new video on it. It's a living guideline that's going to keep being updated. But to go through all of those guideline processes, there has to be a reason for it and some good outcomes. And we can see just to the bottom of the screen that self-care interventions, clearly provide improved outcomes in terms of coverage, reducing the inequalities and the disparities that we see that is so so rampant across the world. It helps to improve the quality of services. We speak about human rights and social outcomes, but also the cost and efficiency that we know becomes really necessary as we move towards 2030. We have certainly the self-care interventions and the systems help to drive that. But beyond that, there's also the characteristics of what it brings to us. We know young people, adolescents, there are those key factors that are really important in making sure that they access services, they uptake services, but then they also are retaining services. Those include, the autonomy, the choice, the control, that young people can have as well in managing their health and basically just determining and defining their destinies. So this is the conceptual framework. It's quite, as you can see, very colorful, very nice. But it's a pitch to say that self-care interventions are not the same without the key principles. You can see those key principles right in the middle in terms of making sure that we respect the human rights, the equality, ethics, and so on. The places of access, they're so diverse in terms of where we can access self-care services and interventions, from caregivers to pharmacists to home. I mean, the list goes on and on. But then, of course, the framework speaks to not just the principles and the places of access, but also how we can create an enabling environment, but also make sure that the accountability from donors, from countries, but also from the individual accountability is also as important as the rest of it. Here, a bit of a busy slide, but in that guideline, we have the self-care interventions that are grouped into different categories. So interventions that are for self-carers and caregivers, enabling actions by health workers, the actions that are needed by program managers, but also by policymakers. But you see in those red dots, the different options. But again, it's not, for me to go through each of them. We're going to be sharing the slides, but also the apps and the resources after this. But those include, as you can see on 1.5, particularly, those on self-diagnosis of health conditions. That's where, my field, I work in HIV. That's where you have the HIV self-testing interventions. We have interventions on self-management of health, individuals' linkage to health, and so on and so forth. I've made a quick highlight as well to the left of the screen, highlighting the fact that despite these interventions and solutions, we still have a myriad of barriers, including age of consent laws that continue to draw us back. As I go to the end, I mean, this is actually fresh off IAS, which is going on in Brisbane, in Australia. WHO has a new recommendation, which highlights the need for HIV self-testing, which can be offered as an additional option for testing at facilities. So this is an updated version of the recommendations that we had in 2019, but also another, which is saying that HIV self-testing can now be used to deliver pre-exposure prophylaxis PrEP, including for initiation, re-initiation, and continuation. I think what this highlights the role of self-testing, not just as a one-off intervention, but also in combination with other interventions as well. I mentioned the enabling environment that was in the framework, but I just wanted to have a slide on that to say that in providing self-care interventions, these factors, of course, will determine access and use, including information, education, financing, training of healthcare workers, commodity security, and so on and so forth. Finally, it is to just say that a lot of commonalities exist between the self-care interventions that we have and also the everyday life of young people. So we know about selfies and how young people I mean, not just young people, we all love selfies, but that's because it puts us in control. We're in control of the lens, we're in control of the camera and the phone. That is that sort of integration that we need in terms of looking at self-care interventions, looking at that control that people, especially young people, can have in controlling their health. It's also not just about self, but also when you look at those self-care interventions, it's also, iterates how selfless, that can be, because most of the things that we do, even though it's for self, we're actually looking at ways that we can, self-diagnose HIV, making sure that if we're positive, we get connected to treatment, and all of the benefits that brings does not just accrue to self, it also accrues to others. So it's self, but it's also about being selfless about what we do in this space. But also just looking at the different ways that we can, promote self and positive self. Looking at the video, but also how we started the session, we saw how, vibrant the co-chairs were. There's a sort of convivial atmosphere that, helps with promoting the self-love, the self-awareness, self-care that we need to have the autonomy, the choice, and the control of our health, whilst at the same time supporting ourselves to completely remove from our norms and our dictionaries those self-inflicting things like self-harm, self-stigma that we know as well can impede our access to these very lofty interventions. So I'm going to be stopping there. I'm going to be handing over back to the chair. Happy to answer questions, but also happy to continue to interact in this space. Over to you, Yasha.
Thank you very much, Wole, for sharing about the 3 billion. I didn't know about that. It's good to know about it. And thank you for the last slide that is really unpacking what we mean by self-care and how does that really relate to us as young people, like how we take charge of taking a selfie, the camera in front, and then you control how you want it to look like, the selfies, the selflessness, then being more positive and intentional about taking care of our health, and in return, being able to then deal with issues of self-harm and self-stigma. Thank you so much, Wole. This has been so inspiring and very powerful for us to know that. So already there is a comment in the chat that says, can we get the link to the WHO document? So thank you, Solo, for that. Wole will paste for us the link in the chat box. So at this point, I'd like to invite we have a healthcare provider amongst us, and it's also very important for us to recognize that when you talk about self-care, yes, it can be done with or without the support of healthcare providers, but also recognizing that it becomes more powerful if there's some form of collaboration between what I'm doing as an individual and the kind of support that I can get from a healthcare provider. So I'm going to ask Nena Chikonde Sonda, I'm assuming this is the healthcare provider, to also just give us a presentation or to talk to us or discuss with us on the realization of self-care and health facilities and the effect of COVID-19 and how healthcare workers can create demand for self-care. Over to you, Neda.
Thank you so much, Nyasha. I'm honored to be here to share with you. And I'll be speaking on realization of healthcare, self-care in health facilities and the effect of COVID-19 and how healthcare workers can create demand for self-care. So it is really humbling that I could be speaking at this platform when we are commemorating the self-care month. So to break this down, I have a brief outline. I will break down the big the big question, the big task that I have into 3. So we'll discuss on realization of self-care in health facilities alone. Then we'll look at the effects of COVID-19. And then we'll look at how healthcare workers can help create demand for self-care. So concerning the realization of self-care in health facilities, as we all know, self-care is the closest link to primary health care. It starts from an individual, then goes to the community, and then it creates that link between the individual and the health facility. Right now, it is a phenomenon that is spreading around the health facilities because most people are aware about it and they are practicing. Healthcare workers individually need to also practice the self-care before you are able to actually encourage someone and help someone through their self-care process. So self-care supports one person to make their own decisions. You know, we are in charge of our own bodies, we are in charge of our own health and our own lives. So if it starts from you, then you transcend it to the others, then you are sure that the effect is going to be there. So for adolescents and young people, they are also encouraged to practice their self-care so that they can promote and maintain their sexual reproductive health rights and access to a lot of commodities that they could need and services as well. So let's talk about the effects of COVID-19. Well, COVID-19 hit all of us in various ways. I'll start by looking at some of the negative effects that COVID-19 came with. Well, on our part in the health facilities, we noticed there was an increase even in depressive symptoms from a number of people, not just the young ones, but as well as the elderly. Then it also brought a lot of life dissatisfaction because it created that disruption in our lives. You know, we are social beings as human beings, and especially amongst the adolescents and young people, when you look at the adolescent stage, it is that stage where we are trying to explore, we are trying to know more, you want to interact with your friends, and then the pandemic hits. So it brought a lot of dissatisfaction because there was that disruption, even in our social interactions. It also reduced on our academic adjustments. You can imagine growing up as an adolescent, you'd want to spend time with your friends at school, interact with your teachers in person and all that. But because of the pandemic, the lockdowns that we had, that became a challenge. COVID-19 as well reduced access to sexual reproductive and health rights services because everyone was scared of it. And because of the lockdown, people couldn't even leave their homes. So you can imagine the young people who had those burning questions, they had nobody to answer them and they had no one to share with. Then it was a challenge, especially for low resource settings, where even issues of internet and technology pose as a challenge, and to those young people who cannot afford to actually access information on internet and also technology, it really hit hard. Then COVID-19 also increased a bit of inactivity in all of us, especially in the young people. If we are used to wake up every morning at 8 a.m., go to school, prepare yourself. But then with the pandemic, you know, there is no school. Not all schools had online sessions. So if they don't have that, then it's home the whole day. So our young people became a lot inactive during the pandemic. Okay, now that we've at least talked about its negative issues, I will highlight a bit about the positive things that COVID-19 did. So it actually enlightened a lot of individuals on self-care because it made people realize that you could actually get through life looking after yourself with minimal interactions with the others. And you could look after yourself, you could exercise, you could eat healthy, you know, like having enough sleep, take time to read, all that came into play. Then the other positive effects that COVID-19 had, it enhanced family support, especially with some of our young people who are living with HIV. You know, there is that disruption where you're not having enough time with your family to sit down with you, ask you how you're doing, because the parents are going for work, siblings are also going to school. But during the pandemic, because it was just everyone as a family, it enhanced that family bond and closeness. It also enhanced the use of online libraries. We saw a lot of updates from different websites, where we could access various kinds of information so that we can just keep abreast with what is going on. It also enhanced the issue of hand hygiene. I'm sure people from WHO and the rest of you will agree with me that most diseases can actually be prevented with simple hand hygiene. And with the coming of COVID-19, it actually alerted a lot of people on how they can care for their own bodies, even just with a simple process steps over hand washing. It also enhanced prioritization of national level self-care interventions, because almost every country was alert to see how best they could help the people, how best people can move on with their lives even during the pandemic. Another positive thing that COVID-19 brought, it helped us to explore other means of sharing and accessing sexual reproductive health rights information. Previously, you'd find almost every young person would only want to access the information when they get to a health facility. When information is even there on the internet, they did not have that much desire to read before the pandemic. But during the pandemic, people have been enlightened because they now know they could access information online and read various resource materials that could actually help them even in understanding their bodies and themselves better. Another positive effect that COVID-19 brought was emotional resilience, especially with the healthcare workers. It was quite challenging, where you have to wake up every morning not knowing whether you're coming back with a positive test of COVID or you will still be negative. So it enhanced our emotional resilience to an extent where we had that positive attitude towards our work and towards looking after ourselves, taking care of ourselves in an extra manner so that we do not get the virus. Okay, so now I will speak with you on healthcare workers, on how best we can create demand. So creating demand for self-care. I think some of the things that have worked for me and my colleagues is involving clients in decision-making. You know, when you know why you're supposed to do certain things, you actually look after yourself better. Even when someone is explaining for you why you need to do something, because you are involved in making that decision, you're able to follow through very well. Creating demand for self-care as well. I think healthcare workers need to enhance the process of information, education, and communication sharing to our young people. I think that will help to enhance social behavior change and communication in almost each individual. And then healthcare workers, I feel we need to be realistic and we set achievable goals, whereby even if you tell someone that you're supposed to do this for you to achieve that, it should be something that is achievable within their means, not telling them things that are far-fetched, things that will not relate to their daily lives. Then healthcare workers must also maintain a positive attitude, even as we create demand. Because if I give my clients a negative attitude towards what I'm trying to encourage them to do, how do I expect them to actually go ahead and do it? So having a positive attitude, maintaining that positive attitude as a healthcare worker, I feel can enhance self-care and it could create demand. Another thing is healthcare workers need to look after themselves first, like provide self-care to yourself, have enough sleep, eat well, do everything that you're supposed to do, look after yourself, like do your health tests, make sure that your health is in good state, even as you are going for work, so that you aid even in creating demand for self-care. Another thing that I feel healthcare workers can do to create demand is to remind our clients that they are not alone. There is always someone available to help them. So if we reassure people like that, I feel the demand for self-care could actually go up. And the other one as well is, as a healthcare worker, we need to be inclusive and to accommodate everyone. I feel if we can be inclusive and be accommodative, we could actually enhance the demand for self-care. Nyasha, I think I will end here, hoping that at least people have gotten one or two concepts from what I've been saying. Thank you very much.
Brilliant. Thank you so much, Neda. I've always said that COVID-19 is like a lemon tree that brought us some bitter, some sad lemons, but then along with it came with the power of us to make lemonade. So I'm so excited to hear you talk about how self-care really improved during COVID-19 pandemic. And it was really a huge realization that we can actually take charge, take control of our health, and also still have the support from healthcare providers. And thank you for also highlighting the link that self-care has when we talk about primary healthcare. That is starts with an individual, then you get connected to the healthcare facilities for extra or needed support at that point. This is really wonderful. Thank you so much, Neda. So at this point, I would like to invite the Youth Care and YouthWISE implementing partners, because YPlus Global and there are some other partners, including Arasa and many more, they have been implementing 2 projects that focus on self-care for young people. The other one is called Youth Care, and the other one is called YouthWISE. Sorry. So at this point, I would like to invite Josephine Odiambo from IREP to take over and share with us in 5 minutes the implementation experience and what has been happening within the Youth Care project. Over to you, Josephine.
Nyasha, just before Josephine comes in, I really do love how the conversation is going and how things are unfolding and information that we're receiving. And, also love the bit where, it was stated that also self-care service providers also need to take care of themselves. And, that's an aspect that we tend to forget. And as we're progressing with the conversation, I just have a question for the young people, or literally not just young people, but however, everyone who's in the space today. And you can leave your comment in the chat box below. And the question is self-care for young people only on digital technologies? I repeat the question again. Is self-care for young people only on digital technologies? So if you have an answer to that, feel free to leave it down in the chat box, and we are going to get to air out your views as the conversation progresses. And I see so many guys are joining in all the way from Kenya, Malawi. We have, as well from Igori, we have guys all the way from the coast. So do introduce yourself, tell us where you are from. And if you're joining us, thank you so much. Welcome to this is a self-care webinar podcast hosted by YPlus Global. And so as Josephine comes in, I repeat my question again. Is self-care for young people only on digital technologies? And with that, we're going to get to tackle your answers after later on in the session. So have no fear. Ruel is here. Okay, Josephine, take it away.
We have no fear because Ruel is here, of course.
That's what's up.
Okay, thank you, Ruel. I think I'd speak to how implementing self-care has been for us in Kenya as Arab. It's been an interesting journey so far. And I'd say one of the most important things that we need to talk about, even before we begin the discussion of self-care for young people, is educate them and build their capacity on bodily autonomy and integrity. Because once, as young people, we understand that we have power over our own bodies, that makes it easier for us to be able to understand the concept of self-care and also implement it. So first, having discussions with the young people on bodily autonomy and integrity first before introducing the aspect of self-care, then having discussions with them on self-care, not only themselves, but also with healthcare providers. Like Neda had mentioned, and also Ruel had mentioned that self-care is not meant to totally remove healthcare providers, but see how best self-care can complement the work that the healthcare workers are doing. So with the support from the different healthcare facilities that we work closely with, we've managed to, bring the concept of self-care to them, and they've been very receptive. particularly the healthcare facilities that are in the rural areas, because we implemented it in Komba Bay, because many a times getting to the hospital in those rural areas is a bit of a challenge. So they've been more receptive to what self-care is about, because now their young people are able to take care of themselves, are able to know how best, if I'm experiencing a challenge and my healthcare provider is like 30 kilometers away, what's within my capability, what is within my capacity to be able to take care of myself. So that has been really helpful. And also, in as much as we talk about self-care is for young people, but these young people come from the community. And many a times with the community, if you're seen as the one who's very vocal, there's a bit of backlash that the young people experience sometimes. So bringing the community aware of what self-care is and what the role of young people is, what their role can be when it comes to enhancing self-care has also been helpful. And finally, just seeing that when we talk about self-care and we don't involve the policy and decision makers, we tend to be shooting ourselves in the foot. Because as you always say, if it is not documented somewhere, it's never happened. You don't have a backing for requesting for what you're asking for. And if the young people who are advocating for self-care go to the community and say self-care is this, self-care is that, and then they're asked, okay, which document do we have in our country that speaks to it? And they don't have it. So having discussions with policymakers to ensure that self-care is included within the different policy documents that we have as a country is another strategy that we as IREP are taking up to ensure that we have backing, legal backing for that matter. We don't want anybody getting arrested because they're doing something that's not within the law. So I'd stick to those things for now. Back to you, Ruel.
Thank you. Thank you so much for that, Jocelyn. And I really appreciate what you put into perspective there in regards to like self-care and how, we had to go about it and the work that you guys are doing back at home, which is right here in Kenya. And so, yeah. So again, as we're talking about how the conversation is going and how everything is unfolding and the information and the work that we're doing in regards to self-care, I did pose a question previously. Is self-care for young people only on digital technologies? So do leave your questions or your comments in the chat section below, and we are going to tackle it as we progress. And as we're moving on swiftly, we are talking about how now we want to switch the conversation and take it to a different part of the country. And we're going to have the Nigeria CSO representative to share lessons from Nigeria on the advocacy to adopt the WHO self-care guidelines. Yes, so the Nigeria CSO representative, please take it away and blow our minds out.
Thank you so much, Ruel.
You're welcome.
Exciting conversation today. A big congratulations to the Y+ group and everyone who contributed to this conversation. I think it's been great so far. Well, Nigeria was one of those countries that started first. Just right after the recommendations by WHO in 2019, Nigeria had been, in 2020, we were the first country to start that conversation around how do we adopt our own national guideline. And there was that compelling need for that because there was a realization that our national indices were fledgling. We have a population of about 202 million people. And the projected increase to grow to almost 400 million by 2050. Our contraceptive prevalence rate was at around 17%. For every woman, there was an average fertility rate of about 5.3. Well, all of these were taken together by the government, and also the add-on talked about our maternal mortality rates, which was almost like 512 women dying out of 1,000. So we came to that realization that we needed to start thinking out of the box. So self-care came at an opportune moment for the country to decide on alternative innovations to begin to see how do we address all of these negative indices I've just described. We also had that thought around the fact that for many of our women, men and families, there was that limitation in terms of access to health services for several reasons. Then came the COVID-19 pandemic, like my co-panelist described, and that realization that we had several challenges with provision for RMNCH services at the health facilities in Nigeria. So we had to come to terms with what do we do to address that. and self-care came in handy at that point. So it was an avenue for us to also see how do we achieve our universal health coverage. So with all of that came that process of adaptation. It's a 3-4 years work. I'm going to be presenting in 4 minutes. So you excuse my jumping over all the different line by line things that happened. Just to say that there was an initial consultation that was led by the government that brought all stakeholders into that conversation. And we formed a think tank of like-minded partners, CSO partners, NGOs, government, professional bodies came together to form that think tank that planned a roadmap for the development of our own national recommendation. So from the WHO recommendation, we decided to form a task force that came up with our own local recommendation that contextualized those recommendations to our own health care peculiar needs. So some of those recommendations by WHO were adopted as they were, while a number of them were actually revised or probably like left behind because our health system and policies does not allow us to use those same approaches for Nigeria. So we had to do a kind of landscape analysis to identify the national policies that we had that supports sexual reproductive health and maternal health and self-care, and reviewing all those recommendations in group to form a template to modify those justifications that were made by WHO. So we had to come up also in the process of doing that, come up with some sense of what kind of activities are we going to do as a country to continue to see this going forward in terms of implementation. And within that portfolio was also the next step in which we decided to look at costing those activities so we can have a sense of how we're going to go about our national scale up for self-care in Nigeria. So it was a really comprehensive process. There were the initial conversation, there were the stakeholder convening that had an expanded group of stakeholders. And within that group, we had the relevant government departments, the reproductive health, the cancer control program, the HIV STI program, the public health and hospital services, and all other relevant government agencies in that group. WHO, of course, was there, but my organization, Johnston Incorporated, was quite instrumental because of our work we had been doing with a similar program, one of the portfolio of products, which was with self-injection of DMPSC, that's depomedroxyprogesterone acetate, is a form of self-injectable, self-administratable contraceptive method. So we had some part of resources that we had to support the government with. So ourselves, all the other partners, government agencies, the primary care development agencies, professional associations, regulatory bodies, and also other right order groups like women groups, people living with HIV, and several other interest groups were involved in that conversation and the convening to agree on what the recommendation for Nigeria would be. Of course, we were also conversant, we realized that the private sector must be a player in this because majority of the portfolio of products in self-care are mostly present in the private sector. The public sector is a little bit constrained because of the fact that our funding is actually in the pot of funding to buy products. So the government is a little bit constrained by resources. So, but most of these products you can find in the private sector. So the government ensured that the private sector was a major player in coming up with these decisions. So for us, out of the 25 recommendations, we adapted 22. Like 5 of them were new. I will not want to go into all of that detail because of time, but some of the lessons that we saw was the fact that there was a lot of interest in developing this guideline from a wide range of stakeholders. The realization that this is a paradigm shift, the overly dependence on the healthcare system that has been failing us, and the fact that we can shift that conversation to agency, people being able to take basic decisions by having access to education materials and health literacy was something that actually stimulated a lot of conversation. So we felt that the starting point was to ensure that we decided to bring that conversation from the provider angle and the need to change those policies like the tax shifting tax sharing policy, which allows more cadre providers to give services to a wider audience was important. We decided to develop a costed plan so we can understand how the process is going to run. and several other things that we talked about in terms of financing, the health insurance, and how we can find some reimbursement in health insurance to continue to finance this. We talked about the M&E system. M&E focus. We have to have a robust M&E to be able to monitor progress and the post-market surveillance for monitoring quality and services. So where we are now in Nigeria is that we have been able to develop that guidance. It has been launched by the government. Now we are at the phase of implementation. So my organization is at the heart of this support because we got some funding from the Gates Foundation to do this. So we are beginning to unlock the different bottlenecks to implementation, trying to understand the policy barriers, trying to understand what are the key actors, and begin to put in place several of the things that we had to do. Well, Nigeria is like 36 countries in one. If you look at the size and the population, so you can understand the overwhelming challenge that comes to in terms of scaling up any intervention in Nigeria. But we are beginning to see things move. We have a national coordination mechanism that's embedded in our technical working group now that's leading this effort. And we are beginning to do a few implementation at the state level. There's a lot of advocacy going on in all the states. I think 22 of the 36 states are bought into this. And we are hoping that in the coming months, we're going to see everyone begin to move towards adopting this practice in Nigeria. And we are really looking to a very bright future because until we begin to understand the enormity behind this innovation, then and I address majority of the challenges we have with healthcare with different groups, either men, women, like my colleague from WHO had just shown us, young people, women, men, families, everyone has a potential to benefit when we can actually encourage people to have agency and take basic literary steps. Our basic literary steps to understand how to take care of their health. So, so I think this has been like a brief of what's been done in Nigeria. I'm happy to share any further insight, even after the webinar. Thanks a lot.
Fantastic. And I really do love what you're doing by integrating so many aspects and so many people in your country, as well as just diversifying the focus groups of self-care, and the number of states that the implementation is taking place. That's a really, really nice, tremendous effort. So you have heard it, guys. Today it's self-care. We're talking about self-care. So happy self-care day to everyone. Okay. And, previously we had posed a question about, is self-care for young people only on digital technologies? And we have heard a really, really nice answer. Allow me to just read through it very quickly. I can't read names probably because of preferences, but here there's an answer where it says, accessibility and affordability are essential for attaining self-care. This already happening at the facility level. And the response was, thank you so much for that question. Indeed, I agree with all the three essentials are to be met in order to attain self-care. I must admit that there are moments when all the essentials are in place in certain facilities. However, I must mention that sometimes there are gaps in the availability of needs through commodities, through government supporting partners, and are slowly getting there. Thank you so much for your responses. And, with that, I'm going to pose the same question to one of our speakers, who is Luca. Luca, if you could be able to give us an answer to that, is self-care, for young people only on digital technologies? And then if after you can answer that, then maybe you can also reel us in on the question on what more can be done to ensure that young people are embracing self-care. And what is Y+ Malawi doing to make self-care a reality for all young people down there in Malawi? So Luca, Ruel says, take it away. Luca, are we together?
Can you please come again on that one?
Okay, so the question that was previously asked that I had asked for us to tackle is self-care for young people only on digital technologies? So you can tackle that, as well as also tell us what more can be done to ensure that young people are embracing self-care. What is Y Plus Malawi doing to make self-care a reality for all young people down in Malawi? Was the question clear, Luca?
Yeah, yes, it is. But as a matter of fact, there are two of us here. So I am Dennis Moya. I am helping Luca with the translation. So we'll be taking a few seconds just to try and make sure that whatever you're asking, I'm able to translate to him, and whatever he answers, I'll be able to transfer that to the group.
Okay.
Sure.
Okay, so as we are waiting for Dennis to interpret for Luca, yes, we do have the interpretation option, guys. If you are using your computer to understand, we have the translation for English and French, as well as Portuguese translation. So we do have the 3 languages in transcript. So if you are struggling, you can be able to use that aspect of the translation toolkit to help you understand the conversation better. So as we are progressing, I'm not so sure if Dennis, you have Luca with us, if everything is well understood in the question, or I can repeat the question again, if that's okay.
All right. I was taking some time just to try to translate Luca.
Yeah.
First of all, just to answer your question, self-care is not for the youth that are on the digital platforms and so forth. Self-care is for everybody. As it is here in Malawi, especially Chikwawa, we are involved in so many activities on the ground, which are more than the digital platform. For instance, here in Malawi, here in Chikwawa, we look at sporting activities as one way of where we are able to educate and give the youth information to do with how they can be able to own their own health and be able to access different services at the different access points that are available in the district. Yeah, and so far what is happening is through the initiatives that are taking place here in Chikwawa, we are seeing greater changes in adherence, whereby we are seeing a lot of young people that are coming out, and the defaulting rates have reduced over the few months. So with education and the capacity that is being instilled in most of the young people, we are seeing greater changes as an implementing partner for self-care as well. YouthWISE, that is.
That's really great. You know, if you're having so many young people that are taking up self-care, and, you know, as you have said, the rate of defaulting is slowly declining, you know, that's really, really great work that's happening down there in Malawi. And Nyasha, I think this is the right point for me to introduce you. We've missed your voice.
Thank you so much, really. So I'm not sure if Luca and Dennis, were you done?
No, not yet, not yet. We still have got a few things we want to add.
Okay, please go ahead.
All right. So Ned mentioned something about creating demand for self-care. Fortunately for us here in Chikwawa, we already adopted some of the things that were outlined there. For example, through other supporting partners that are working within the district, we are able to engage healthcare workers, and we are able to share with them some of the sentiments that are coming from the community. For example, issues to do with improvement in attitude, especially when attending to recipient of care. So with those initiatives on the ground, we are seeing positive results, since the healthcare providers are more welcoming now than they were earlier on. So those kind of changes are really addressing the issue of self-care, because now we have more young people going to the facilities to access the different services that are there, which was not the case in the first place. Thank you on that one.
Thank you. Thank you so much, Luca and Dennis, for sharing with us the experiences happening in Malawi, and the question, like, is self-care for digital self-care only for young people or for everyone? So thank you so much to our panelists for this conversation and unpacking some of the key concepts that we're looking at here when you talk about self-care. So I picked a couple of questions from the chat box, and I'm actually going to quickly just direct some of the questions to you as the panelists, then you can be able to just respond back. And colleagues, if there's anyone who also has a question right now that they are pending, that they're not previously put in the chat, feel free to raise your hand, and after we've gone with this round, we can also start to pick on those questions. So the first question that I have will go back to Wole. So the question that came is beyond the developing of the guidelines that WHO is doing in terms of providing strategic guidance on how we can navigate the implementation of self-care. What else are you also doing as WHO to ensure that people are aware of self-care and it can actually be implemented, etc.? So over to you, Wole.
Thanks, Nyasha. Well, very interesting question. I think there's a lot that WHO is doing in not just making the guidelines, but also in trying to make sure that those guidelines are implemented in countries. I mean, you've seen, probably you have a bit of a hint from the video that once we make guidelines, one of the things we try to see is how is it being implemented? Is it even being implemented? Is it useful in countries? But like and like I'm sure many of you know, once a guideline is made, the moment it gets into countries, the better off. There's so many other considerations that begin to come in that many times is beyond the purview of even global institutions. One of the key barriers, of course, is the issue of laws and policies. I think Adewale mentioned that. Other speakers mentioned that as well. Those laws and policies having the right guidelines and policies in place, having, for instance, for young people, this continued problems of age of consent to access PrEP or testing. In some countries, to get tested, you have to be, without parental consent, you have to be, probably 18 and above. So no matter what the guideline says on self-care, if those basic laws and policies do not favor access, then of course you have huge problems on implementation. So one of the key things that we do is try to use our comparative leverage and advantage to influence countries, speak with ministries of health who are in charge of making these policies, but also trying to link with young people. So myself and Global Y+, but also Y+ in different countries in Kenya and so on. We try to partner and make sure that the advocacy that is needed to drive the push for changing these policies, of course, are in place. I wanted to make sure that I mention as well the element about creating demand. I think there's been a bit said about that from different speakers. It's important to accept as well that when you create demand, you have an ethical obligation to actually meet that demand. And here I am speaking a bit to the health systems challenges that we have. I mean, not just on self-care, but so many others. We know we have huge, supply challenges, from prevention to testing and so on. There's huge, problems when it comes to supplies and and making sure that these commodities are right on time. So I think we have to balance that. When we create demand, we must also ethically and even legally, I'm sure, be able to meet the demand as we create them. So that's a push as well for making sure that we strengthen those pillars of the health system, including the supplies and the supply chain, to make sure that those are well put and well available. There's a question on workplace interventions. I can answer that in the chat box, but I think that's from Leonard. I can respond to Leonard in the chat.
Thank you so much, Wole, for really sharing what else WHO is doing, and also providing us with a clear path of like what happens then when there's a guideline at global level and happens at country level. I just forgotten to mention that we were supposed to answer in 2 minutes. Then you can also put the rest of the comments in the chat. So the other question that I have is for Dr. Adewole. So I think Nigeria became one of the first countries, my literature review still serves me right, to adapt the WHO self-care guidelines. And so I would like to hear from you quickly, like from the time that the guidelines were developed until now. I'm not sure what is the time in between in terms of implementation, but do you feel there is a change probably in terms of how the healthcare system is accepted self-care as something that people can do in order to safeguard their health and well-being? Or is there even a change right now as the implementation is rolling out? What are we seeing? Do you have anything that you can share with regards to that? And in just 2 minutes. You are on mute.
Oh, Lord in heaven. Okay, so I've been talking for a few minutes. All right, so I hope I've not used that of my 2 minutes. But in Nigeria, I think we moved several steps like I tried to discuss. There's always that early phase where you want to bring everybody into that conversation. I want to ensure that there's that overwhelming acceptance across all the right older groups. And that's where we have been able to move immediately from developing the national guideline, ensuring that there's a government sign-off, and then moving to the phase of getting the state or the subnational input into that in terms of acceptance. So where we are now is ensuring that within the sexual reproductive health portfolio of work, which we call the RAMCA platform in Nigeria, we want to embed that implementation in there. There's a need to ensure that all the policies are actually like streamlining to allow that to happen. And where there are some conflicts, we want to ensure that we can actually revise the necessary documents to make that happen. So right next to that is coordination, which, like I said, Nigeria is a huge country. There was a need to ensure that we have a national coordination. We've embedded that within the technical work, National Reproductive Health Technical Working Group, which was the best place for that because of the mandate for that committee. So now trying to unlock the different aspects, like what are the service delivery needs, what do we need in terms of supplies, and several other issues like Wally had mentioned that we need to pay attention to for full scale up. I think every country, we need to look at this consideration, contextualizing it to their different political, policy, and other landscape to be able to start up implementation.
Brilliant. Thank you so much, Adewole, for that sharing of what currently is happening in Nigeria. Then I also go to Neda. So Neda, there was a question for you that came in the chat, but you had also attempted to answer it. But it would also be if you could also just then, go through with it again in the next 2 minutes. So the question was, availability, accessibility, and affordability are essential for attaining self-care. Are these already happening at the facility level? And also, if you could just also share like what really is the uptake of self-care amongst young people at facility level. Over to you, Neda.
Thank you so much, Nyasha. So on availability, accessibility, and affordability, I must agree that, yes, the 3 essentials must be met for one to attain self-care. However, I need to admit there are moments when all the 3 are met and readily available for people to access. But then there are certain times and in certain facilities where there are gaps, especially on availability of commodities that are needed to support self-care. But we're grateful that through government efforts and partners, a lot of support has been coming through. So even our challenges are very much minimized. You asked me on the uptake of self-care among young people in practice at facility level. So the uptake amongst the adolescents and young people is really taking an upward turn in our facilities. So what we've started doing as facility focal point persons, those ones who work with adolescents, we are engaging the young people in all the activities that are conducted at the facility that concern them, because we want the young people to have the power to own what they want to create, so that they are also responsible for the results of that action. And another thing is we are also encouraging them. We are training and retraining peer educators who could be there for their friends, so that they can give them the correct information on the products to use, where they can get the products. For example, contraceptives, could be self-monitoring blood pressure checks, pregnancy test kits. So when we train the peers who are equipped with the correct information, they're able to share with their fellow peers on a peer-to-peer level. Thank you so much, Nyasha.
Thank you so much, Neda, for answering the question. So to Leonard, I think I'm sure you can notice that there is a robust interaction happening in the chat, where Leonard did ask the question to do how do you promote self-care in the workplace, and thank you, Wole, for answering that and also providing a resource we can refer in the chat. And then to Josephine, in a minute, what is it that you think we can do to ensure that we really create a strong movement of young people who are self-care advocates?
Please repeat the question kindly.
What is it that we can do as young people to create a strong movement of youth care advocates? What do we need to do so that we have more young people embracing self-care?
For those of us who are lucky to already know what self-care is, I think the baton is with us for us to also share with other young people on what self-care is, and also try and make it as simple as possible. As simple as self-care looks like: you have a headache, you go to the nearest pharmacy with you there, you get a painkiller. Self-care looks like if you're on your period and you're in pain, and that day your pain is just over the roof, you go to the facility, you get yourself a painkiller. If you're hungry, you eat. If you're feeling tired, you sleep. Make it very simple for them to be able to understand, and then gradually grow into it. Especially if you're working with young people within the rural areas, make it as simple as if you go to the shamba today, you went yesterday, today your body is a bit feeling tired, you don't have to go today, you don't have to go every day. So make it very simple for those of us with the information. Let's share it, and as we share it with the other young people, there are some of us who are lucky to be in policy and decision-making spaces. Represent the other young people very well. Tell those policymakers what we want as young people, so that by the time it's trickling down to the community at the policy level, things are okay. So we don't have to struggle with the issue of a 13-year-old saying they want to get a contraceptive as self-care for them, but then legally she can't because our policies don't allow it. So just looking at those different tiers at the policy level for those of us who are in those spaces, advocating for those who are of us at the community, sharing the information with the different community members, and then looking at now peer-to-peer approach as we share the information of self-care.
Thank you so much, Josephine. Thank you. Luca and Dennis, what more can you do from your perspective to ensure that more young people embrace self-care?
Nyasha, I'm seeing Dennis has some statements in the comment section where he has stated that COWHLA and Y+ Malawi are also making sure that young people living with HIV are also able to be assisted with mental health issues. And what we are finding out is that mental health has great influence on self-care outcomes, hence the approach to try and tackle mental health issues so as to control a positive self-care outcome form for young people. And Dennis has also gone on to add that as part of our initiatives, we have also legally managed to raise awareness on HIV Act, where National AIDS Commission officers sensitized 250 Y+ members. It's a huge number, 250 Y+ members. The sensitization process focused on tackling issues to do with HIV stigma and discrimination, which is one part the HIV Act deals with. So that is from Dennis and Luca all the way down in Malawi. Yo, that's amazing. That deserves an applause. You know, deserves an applause. Yeah.
Thank you so much, really, for taking care of the chat. And thank you, Dennis and Luca, for the contribution. So I think me and Riel at this point, we can say we are safely done with the moderation, and we are handing over to Joyce Oma from Y+ Global as she wraps up the conversation for us. Over to you, Joyce.
Wow, thank you.
Here is the part where Joyce had the surprise. I told you guys we have a surprise. So here is the surprise coming.
Thank you so much. Thank you so much, Nyasha. Thank you, Ruel, and thank you everyone for the very interesting conversations that are happening. And yeah, not that anybody said it, but also today is Happy Self-Care Day. I don't know if we get to say that. And in the past 1 month, YouthWISE and Youth Care partners have worked very collaboratively with all of you. I think I've seen some of these names pop up on the campaign that we've been having from the 24th of June to today, which is the ultimate day for our campaign, which is 24th of July, which is also the Self-Care Day. So today we celebrate along with the theme for Self-Care Month this year, and we are celebrating our resilience, adaptability, and thriving in adversity. You've heard of the much progress that we have made, the adoption of the self-care guidelines in countries such as Kenya, Uganda, and Nigeria. You've had Wole talk about the interventions that are no, the recording should continue. Is it continuing? Okay, all right. So we've also talked about how unethical it is for us to continue creating demand without necessarily creating, making sure that the commodities are available. In the past month, we've done a lot, and I am just very excited to show you some of the things that we have been able to come up with. As Josephine has just rightly said, that we need to make self-care simple. So in the past few months, we've been working with the task team of 9 young people in all their diversity to develop a mini resource package. It's actually ended up being a web page to ensure that young people are communicating self-care to each other in a way that they can easily understand. So I'm going to ask my colleague Tawanda to just quickly post the link in the chat. And yeah, I think the link is already in the chat. And for the next 1 minute, just you can run us through what the web page looks like. This web page is hosted under the Y+ Global page website, but it is not just a Y+ Global effort. It is thanks to all the partners who are working on the Youth Care and the YouthWISE projects, and also all of you who are not necessarily part of these projects. So as you can see, the page is very youth-friendly. It has materials that have been developed by young people all the way from Philippines, all the way from Botswana, all the way from Kenya, all the way from everywhere, you know. So we are really excited to share with you this tool. Please do click on the link that Tawanda just shared. Please go through the page, interact with it, share with us some of the materials that you've been able to develop from your side as well, and we can be able to include it on this page, as this page is for young people, and this page is specifically dedicated to self-care, and that is how much self-care is a necessity, and self-care is something that we need to carry forward. So initially we had promised that our call would run up to 3:20 CAT, but we are still here. We are going to be sending emails to you all just to so that you have this link to the self-care page on the Y+ Global website. Please feel free to furnish that page to make it simple, to make self-care known amongst young people in all our diversity. So I would like to take this opportunity once again to thank you very much. Thank you to our esteemed panelists. Thank you, Wole. Thank you, Dr. Adewole. Thank you, Josephine. Thank you, Luca and Dennis. Thank you, Neda. And thank you all for joining us. I know last week we had Women Deliver, but I still see all of you still here. So I'm really honored. And on behalf of Y+ Global and all the partners from YouthWISE and Youth Care, it's happy self-care day to you all, and we hope that you continue practicing self-care every day for the rest of this week. Thank you very much, everyone. Have a good one. Bye.
Happy self-care day. Happy self-care day. Happy
You can
self-care
come
day.
off camera and wish us a happy self-care day. Come on.